You're welcome back to my channel, and in today's video I'm going to be sharing some interview questions that I was asked when I applied to a care home here in the UK as a care assistant. So I've just been going here and there attending interviews, and this particular one I have already got the result of the interview, like I got the job. That's why I said, okay, let me share these interview questions with you, because most of the questions I was asked are questions that have been repeated in several interviews that I attended for the role of a care assistant in the UK. So without wasting so much time, let me dive straight into the video. So the first question I was asked was, can we meet you? And of course, when they ask such questions, I was going to talk about my name first and then my skill sets. Like, my name is Bimbo. I've been a carer for so years. I volunteered back home in Nigeria, and I'm compassionate. I have an excellent communication skill. I am friendly. I give attention to details. I have empathy, sympathy. Just name it. I'm very patient. Every mother is naturally a carer, blah, blah, blah. And after then, I was asked why I wanted to work with that company. And of course, I'd done my background check about the company, several positive reviews from service users. So I mentioned that, and the fact that it is a care home and they actually train people. So I said it's going to be a place where I can, attain career progression. Like, I can at the end of the day do my NVQ2, NVQ3, and possibly transition into the nursing sector in the future. So I see their company as a good place for me to progress career wise. The other questions were more of care questions now. So they asked me what I understood by the word safeguarding. So this is a very common word used in care setting as well as in schools here in the UK. So basically, when I told them that safeguarding is like promoting the well-being of the service user by making sure that they are away from harm, and I gave an illustration, like, okay, take for instance where I once worked, that there was this service user that was violent, and there was this other service user with dementia. And when people have dementia, they tend to wander a lot, like they can just be walking up and down aimlessly. So I said that this service user that was wandering on the walkway, then this service user knocked. In fact, the person did not even knock. He went straight into the room of this person that appeared to be violent. They hadn't known that he was violent. So he entered into this other service user's room, and then that one blew his face and got him injured. So they had to put safeguarding measures in place by, one, putting an alarm at the door of this service user that punched the other one, so that whenever his door opens, we'll check to see that he is actually the one opening his door and not another service user trying to gain entrance into his room, so as to avoid such case that happened. Another measure that was put in place was to paste a notice on his door that he should keep off. Don't open his door at all, except he opens it himself, because of course this service user still got a lot of independence. So I gave that illustration, and that was it. Then the next question I was asked was what I understood by the word confidentiality. So it's just an English word, and I said confidentiality is simply keeping what is private, especially because as a carer you are privy to the medical history of your service users, but it's not ethical to start discussing service users at home, or I should keep their medical history private. I shouldn't discuss any service user to whoever. So basically that was what I told them about confidentiality. And then the next question I was asked was to describe an event where a service user, displayed a challenging behavior towards me and how I handled it. Unfortunately, I gained that experience, although it didn't actually happen to me, but I referred to it as something that, happened to me. So there was this day we were at the lounge, and some service users were at the lounge as well. And this particular person, service user, was offered a cup of tea, a cooper. So As the carer offered to hand over the tea to the service user, the service user just poured the tea on the carer. And we all gathered there. So I told them that there was a time I offered to make tea for a service user. After handing the tea to the service user, she poured it on my shirt. And some of my colleagues that were around, they came to assist me, and they wanted to know more. The interviewer wanted to gain more understanding about what happened. And she was like, how did my colleague come to assist? Like, were they violent? Did they challenge the service user? And I was like, no, that what they did was to bring an extra empty cup, and then they told the service user, they calmed the service user down, and they encouraged the service user to pour the remaining tea, because there was some tea left in the cup, to pour it inside the other cup, and then to either pour it inside the other cup or to drop that cup. Although the service user was kind of aggressive, but in the end she obliged. And okay, they were like, okay. So basically, I was asked 8 questions, and so I have just 2 questions left. And I must say that the little experiences that I have gained working with an agency and with domiciliary care that I am working with have really helped me to gain so much confidence for any kind of interview at all. So I've attended countless number of interviews since I arrived in the UK in the past 2 months plus. So guys, the next question I was asked was, if I entered into the lounge in a care home and I found a service user lying on the floor, what would I do? As simple as this question is, actually, I'm going to make another video and I'm going to discuss what happened to somebody that I know. So I was asked that question and I said, okay, if I find a service user lying on the floor, I'm going to press the buzzer. I made a video once that I said, if a service user is about to fall, how do you prevent it? You don't prevent a fall. Allow this person to fall safely. So I said that I was not going to carry the service user. Rather, I would raise alarm. I'll press the buzzer and seek for help, and then I would probably report the case to the manager as well as document the events. So that was how I answered that question. And then lastly, they asked me where I see myself in the next 5 years. So I said, in the next 5 years, I hope to have done my NVQ2, my NVQ3, and possibly, become a nurse in the care home. So that was how I answered those questions. And the very same day that I went for that interview, they sent me a mail that I was successful. And guess what, guys? I did not apply for this job online. Rather, I walked into the care home to obtain their application form. And funny enough, when I checked on Indeed, I didn't find their adverts. Like, they did not advertise. So if you are in the UK and you've been looking for a care job and it seems you've been applying online and no job is forthcoming, why not just try and see if there are any care homes around you, and then you can walk into those care homes and ask that you need the application forms. Perhaps some of them did not bother to advertise their vacancies. So guys, I got a job with a care home. So wish me congratulations. Like, just tell me congratulations in the comment section. And this is the end of this video. If today is the first time you're seeing my face, please do well to subscribe to this channel and like this video and turn on your notifications. I hope to see you in my next video.